I want you to picture two scenarios. In the first, you work in the Kitchener-Waterloo area at a plush 9-to-5 job sitting behind a desk. You have a decent amount of flexibility in your day. Oh hey, Mandy and Shelley, is it break time already? I'm right behind you. And you don't for a second question your safety in the workplace. Now, I want you to picture scenario 2. You live and work in Thunder Bay, a prominent city situated in Northern Ontario. You average anywhere between 10 to 12 hours in your workday performing physically laborious jobs at a resource-based industry such as mining or forestry, and you've probably experienced some form of injury, whether it's cuts, lacerations, or full-blown fractures and tears. So which would you choose? Probably the former, right? But for roughly 1/4 of the labor force in Northern Ontario, scenario 2 is reality. The rate of work-related injury can be as high as 6.85 per 100 full-time employees and oftentimes requires time off work. The resultant effects can include a loss of income, adverse physical and psychological consequences, and a decline in employer productivity. More alarmingly, these same workers are 16% less likely to return to work in a timely manner in comparison to their Southern Ontario counterparts. To put this into perspective, their disability duration, or the length of time from incurring the injury to when they return to work, is significantly longer in the North than the South. But why is this the case and what's causing this? That's where my research comes in. Using a twofold investigative approach, I'll geographically map the distribution of key resources in an area that serve to remediate the effects of an injury. This form of mapping uses network analysis to determine the network of health and rehabilitation services in an area, who has access to the network, and the ability to travel between them. Survey and in-depth interviews will further complement and supplement this information and allow us to identify and explore the barriers acting on disability duration and preventing a timely return. This will provide a clearer understanding of why Northern Ontario is lagging in the disability agenda. We'll be able to guide employer practices, inform upstream decisions on the resource allocation for treatment and rehabilitation of injured workers, and gradually move in the direction of providing and creating equal opportunities for all working Ontarians.